Yes.
All right, looks like we've reached the top of the hour or just after, so I think we'll go ahead and get started. Others may join us as we progress, and that'll be just fine. Hello again and welcome. You are at the University of Washington School of Medicine session on advice for reapplicants, focusing on the interview today. I'm Leanna Muskie. I use she, her pronouns. I'm a member of the Confederated Salish and Kootenai tribes of the Flathead Reservation in Montana, where I work as a family physician part-time. I also serve as the Associate Dean for Admissions for the School of Medicine. I'd really like to welcome you and thank you for taking time to be with us here today. I would like to take an opportunity to introduce the admissions team members who are with us today, who will be assisting in providing the advice for the reapplicants. So I'm just going to go down the panel here. Sarah, do you mind introducing yourself?
Hi, welcome everyone. My name is Sarah Hafner. I use she, her pronouns, and I'm the administrative manager in admissions.
Great, thank you, Sarah. You'll be hearing from all of the team members today, so I wanted to be sure that you had an opportunity to meet them before we got started. Jordan.
Hi everyone, my name is Jordan, she, her, and I am the admissions analyst here with the UW School of Medicine.
Thanks, Jordan. And the other member that we have with us today is Rebel.
Hi everybody, I'm Rebel. I use she, her pronouns, and I am the program coordinator here at admissions.
Excellent. Thank you, staff. And here I'm having that problem again where I'm not able to, there we go, advance the slides easily. Before we get started, I'd like to take the opportunity to acknowledge that the land on which the University of Washington stands was land of the, was previously occupied in, excuse me, as the traditional home of Tulalip, Muckleshoot, Duwamish, and Suquamish tribal nations. I'll allow you to read the rest of our statement there, but I would draw your attention to the website at the bottom of the page, where you might go learn a little bit more about the meaning behind a land acknowledgement and what can be done in real time to really make a difference and honor those tribal nations who are still with us today.
We also wanted to take a moment to acknowledge that we're unable to do a live closed captioning for today's presentation. For that, we apologize. We're not currently able to do that, but we will be posting the recording with closed captioning provided by YouTube. So keep your eye out for that. We'll post it on the website, the link on the website when that's ready. But we are working toward rectifying that in the future and having live transcription during our presentations. Thank you.
Thank you, Sarah. So I just wanted to take a quick minute to acknowledge one thing, and that is that I am struggling a little bit with some laryngitis, not good timing in terms of having to meet with you all today and provide this information. So I will be relying on my team members to help me out in terms of presenting the information going forward. So I apologize in advance if at times it is hard to hear me. I will work really hard to make sure that doesn't happen. For today, I really think it's important for you to know what to expect. So we'll start by reviewing the purpose and the goals of this session. This is sort of the agenda outline. We'll review again the mission of the School of Medicine here at UW and how we utilize holistic review to look for candidates who meet that mission. We'll talk very specifically about the interview at our institution and how it's structured, what are the objectives of it, and review some of the challenges that folks who have been unsuccessful in the past have come upon, and then ideas for how maybe to improve your interview skills. And then through the course of the talk today, we did receive your questions that you submitted ahead of time. And so we've tried to incorporate those into the talk throughout. So stay tuned, keep your ears sort of open for those. And then at the end, there may be a handful of questions that we didn't answer specifically that we've tried to identify. If there is time at the end, we'll certainly address those as well. Just a reminder, excuse me, that this session actually is replacing individualized feedback. It was with great deliberation and a lot of thoughtful sort of dissection of our available resources through the end of the admissions cycle for the entering class of 21 into the summertime, that we had to come to the hard decision to not provide individualized feedback for disappointed applicants in this season. So just want to make sure that you understand that our purpose for having these sessions are for those folks who were unsuccessful and had interviewed with us. If you don't fall into that category, you're welcome to continue to listen, but please know that the information that we're providing is specifically tailored to those applicants. And it's based upon the many years of experience that the team has in giving individualized feedback. These are very common themes, things that we tell people repeatedly, and the common pitfalls that we see. So that is the purpose of us getting together today. Our goals for this session are threefold. We'd like to share with you again, just to review the approach that the School of Medicine here at UW uses, specifically around the interview, share some common pitfalls of unsuccessful applicants that we're familiar with, and then provide ideas for how to improve your own personal interview skills. Excuse me. If you've spent any time sort of looking over any of the information that's available to you regarding the UW School of Medicine and the WAMI program, you'll have become familiar with the fact that we're a very mission-oriented, mission-driven institution, where we're really looking at meeting the workforce needs of the region that we serve, our 5-state region. So here you can see sort of the mission and values of the School of Medicine as the institution delineates them. And then within admissions, we take these this mission very seriously. We look at the sort of multiple prongs that our mission holds, with specifically meeting healthcare region needs of our region, looking primary, with a focus in primary care and underserved populations, but also the advancing knowledge and the leadership in biomedical sciences. So we're looking for applicants who really can meet one or more of those prongs of our mission as we review applicants. When we're reviewing applicants, we utilize holistic review, and I'm sure this is a concept that you've heard perhaps from us in the past, but also throughout, sort of your journey into medicine. Most medical schools have employed the core values and concepts of holistic review, which means we look at not just somebody's academic performance to help us determine whether they're a good fit for our school, but we really look at all of the parts of the applicant, which include the experiences that you've had and the experiences you've sought, the attributes that you bring with us just by who you are as a person and innately. And then we also balance that, as you see across here, with academic performance in the form of metric numbers. So we take all of those components and we weight them throughout the process, and that includes from the time your application is screened to determination of interview, throughout the interview process, and then in the decision-making process. All of these components are taken into consideration as we evaluate each candidate. So I'm going to turn the slides over to my colleague, Reapplying, at this point.
Yeah, so from the interview, we kind of broke it up for you to see from the application. What we're learning is about your motivation for medicine, your clinical exposure, service, experience, leadership, your research experience, and then what other people think of you from the form of letters of recommendation, and then as well as your academic ability in the form of your metrics. And from the interview, what we're looking for is to find your motivation for medicine. We're looking at your communication skills and your empathy, your problem solving skills, your understanding of medicine, and your understanding of yourself, and an evidence of curiosity. So those are the type of things that we're looking for in the interview. And as you can see, this just adds into the overall holistic review of each applicant.
So as we dive a little deeper kind of into the components that make up the interview, what we're looking for, Ravel gave you an idea of kind of those big picture things and to see how those overlap also with the application, right? Because as is all the decision making, it's never just one piece, it's always multifaceted. And the same thing goes for the interview. There is a lot of components that we are trying to get out of that interview. It's a half hour, but we really, have our committee trained to try and, piece out the pieces that they really need to know to ensure that you're going to be not only a good and successful medical student, but a future physician that we would be, proud of. And so some of those big areas, motivation, communication, understanding of medicine, and problem solving, and overarching through all of these things are your understanding of self, which attaches to that maturity, your empathy for others, teamwork, and leadership, which kind of coincide with all these other pieces as well. Your motivation you get at obviously is the why medicine. And that's something that not only will you write about in your application, but what we're looking for when you get to the interview is to really kind of expand on that for us. And it's something that you should know, right? It's about your passions, your interests, and it's really, again, right, that understanding of self, what you've kind of thought through, reflected on to your path to medicine and what that means to you and what that kind of looks like and how you communicate that to us. Leading into communication being obviously a large part of it. Physicians spend a lot of time communicating with their teams, with patients, with others in their workforce, with their community. And so obviously that's going to be a huge portion of what we're looking for in that interview, whether it's virtual, so we see you, on a screen, or in person. We're looking for not only your verbal communication skills, are you able to concisely get your point across? Are you able to really, help us think through, issues with you, but also is your body language comfortable? Is there something that's, concerning or, is kind of a piece that you might want to work on? And also in that communication is talking across differences, right? And is learning to work with others or be able to work through difficult situations with empathy and maturity, and often in a teamwork or leadership position, right? So reconnecting all of those, and that leads right into understanding of medicine. What do you know about the career you're trying to get into? What are the rewards and challenges? What does the healthcare system look like? What does that mean for patients who are different than you, who are different from each other, and how that works? And then taking us through problem solving is another big component of seeing how you think on your feet, your analytical skills, because it is definitely a problem solving profession. And so those are kind of the big components that we look for. And you always want to think about them as an intertwining piece. A question that a committee member might ask isn't necessarily gauged towards completing just one of these areas. It may be looking for that multifaceted approach to get a better understanding of how these all interweave in your understanding and what you're bringing to the picture.
Thanks, Jordan. And we're just going to talk about some of the common pitfalls and low performance areas of unsuccessful applicants. So some of the things that people fall into is not being able to clearly articulate their motivation for medicine, why medicine over another helper career. Another thing that people fall into is a lack of understanding of the medicine and healthcare profession. This also obviously goes into your motivation for medicine. If you aren't really understanding what the position involves, you probably aren't as articulate about why you want to be a physician. A lack of understanding for social determinants of health, description of experiences rather than reflection. The reflection piece is really important about your experiences. We want to know how it impacted you and what you learned rather than just what you did. And then again, your just communication skills, that includes both verbal and nonverbal. And then your preparedness as well. If you're over-prepared, it can sometimes come off as too much. And if you're underprepared, it can also come off as a little too little. We want you to be conversational, but not reading off a script.
So at this point, we're going to move through those pitfalls that Rabail just mentioned, and we're going to talk about each of them in a little bit more depth for you so that you really understand how to improve. And what we're hoping that you're able to do is reflect on your own experiences and think about how about which issues you might have had in your interview and how you can improve. So one of the big issues that our applicants come across is not clearly articulating, as Rabail said, their motivation. So this is going to involve a lot of self-reflection on your part, right? About why you want to be a doctor and why specifically a physician and not another member of a healthcare team. We have seen quite a few applicants who have who at the end of the interview, the interviewers might say, they seem like they're going to be a great asset to the healthcare profession, but I can't see why a physician and not say, a public health official or some such thing. So it's really important to fully understand medicine so that you can articulate why it's the best fit for you. So, and the thing about this too is that your motivation likely hasn't changed since you submitted your primary or your initial application through AMCAS, where you wrote about it in your personal statement. But that doesn't mean that you're going to repeat your personal statement for the committee. At our institution, all three of your panelists will have read your entire application and will be coming in to your interview with that information in hand. And the interview is meant to give a fuller, more nuanced understanding of who you are. So what we encourage you to do is think about these questions, reflect upon your motivation, and what you can bring to the interview is perhaps a more nuanced approach to your motivation, or you could think about it from a different angle, right? So don't repeat your personal statement, but we know that it hasn't necessarily changed. But think about other ways you can explain your motivation to our committee. One of the things that's really valuable is demonstrating not only what you understand about medicine, but how you understand yourself and how that ties into your motivation, right? Why is this career the fit for you? And what are you going to bring to medicine? What is medicine going to bring to you? All these kinds of questions are what we're hoping that you're reflecting on your own prior to coming to that interview. That being said, your answer to this question should be concise. Because they already have read your personal statement, you don't need to spend a lot of time in your interview talking about this. But we also want you to be genuine. So even though you know this question is coming, as Rabail sort of hinted at, you don't need to memorize what you're going to say at this point. But we just want you to have reflected and have a really strong understanding of these kinds of questions coming into your interview.
So leading off of Sarah's with the motivation is she touched on a little bit about part of that understanding of your motivation, right, is that exploration and the understanding of the field and what you're getting yourself into, what you're excited and passionate about doing in the healthcare profession, specifically as a physician. And so one of the other pitfalls we're seeing is that often people, maybe have done the exposure piece, and you see that in the application, but by the time we're speaking with them in an interview, there maybe isn't the depth there, or we realize the understanding of the actual practice of medicine or patient experience, or the frustrations or burnout are maybe not quite as nuanced or haven't been thought about enough, and often then recommend further exposure to healthcare and the practice of medicine and or specifically the physician role. And so, asking yourself, as you are doing your exploration, as you're reworking your application, as you're thinking about what to say, and to also check to see if you're prepared, in that kind of self-reflective state is, what kind of practices are there? There's lots of different specialties, and, not that you have to discover all of them, but, you can do some legwork on, even if you can't shadow lots of specialties, there's podcasts and there's articles and books and information about different specialties that you can read and consume and listen to that can help gain different perspectives, even if it's not necessarily doing kind of one-on-one interactions. What do from those, you're going to build on what is the role of the doctor in a community. Rural community doc, like Dr. Muski, is going to have a very different experience with her community versus someone who's maybe a lead trauma surgeon at Harborview. So, trying to learn a little bit of the nuances of the community role of a physician, what that may look like in different spaces, and what that might look like in kind of public health and social health as well, depending upon if that's an interest in you. There's also that understanding is a big piece of access and what patient care looks like in a lot of different ways and for different areas. Who pays for medical care? What is kind of insurance like? How does that function? How does that work potentially in different settings, a free clinic versus at a large hospital? You don't have to be an expert in insurance for patients. We're not looking for you to have kind of super level deep understanding of every in and out, but we need you to have a decent understanding of the system, and especially in the US specifically. And then from there, with your understanding of the physician role, if you're shadowing, scribing, medical interpreting, or listening to podcasts or reading books from physician, what frustrates them? What's causing burnout in a lot of in the physician workforce? What are some of the hurdles and day-to-day things that maybe are really challenging in this role, but also what makes them happy, what keeps people coming back, what sustains people in their practices, or what is still, giving people lots of energy every day to keep doing what they're doing, and how do they maybe switch or find that differently during their career. And then obviously things that are going and changing. Technology is a huge part of medicine now. We've seen the huge shift to telemedicine in the pandemic. What does that look like? What does that look like going forward? How has that changed access? Ask yourselves these questions and start maybe looking at, ensuring that you're keeping up with the news around healthcare, but also what that maybe looks like in a bigger scale, in a smaller scale. We're really looking at the end of the day for you to have a good understanding of not only the role, but how the role functions in the greater healthcare system, because that's going to be such a huge part of what physicians deal with, can change, be a part of as you move forward in this career. And we need you to be able to have reflected on and know those things, because by the time you've done that exploration, it should be a lot easier when you get asked a question about it to be able to have an answer or a patient story or reflection on something you liked, didn't like, or learned. So it should come easily if you've done the exploration and reflection around these kinds of issues and around these kinds of topics.
Sorry, too many buttons to push. But thank you, Jordan. I couldn't agree more with sort of your assessment of, I think it becomes more natural to be able to speak to topics and to answer questions that you're faced with if you've really spent some time and it becomes part of your fabric, right? Like, so that it's not just a concept that you heard of once in a conversation, but it's really something you've observed or you've studied, perhaps you've lived, and you can speak from that perspective. Really can help you feel confident in the interview. And we'll talk a little bit more about that later, but I wanted to delve a little bit beyond just the generalized understanding of the healthcare. Another area where some of our applicants our interview committees will note, and they're actually asked to assess this in some fashion with questioning and or looking through applications of applicants, sort of understanding of what healthcare looks like in the United States, but really what are the factors that cause there to be differences in how people think about health, access health, receive healthcare, all of those things. And it boils down to some degree to the social determinants of health. And at this point, we we hope that you have heard this term. If you haven't, then that perhaps is why there wasn't success in the interview process at this point. But we really expect that you'll have some ability to converse with a fair amount of depth about what social determinants of health mean, how they affect particularly perhaps the communities that you're either interested in serving or that you've had experiences with. How do you see that in the face of some of the challenges or some of the obstacles that you may have seen with populations you've served? So specifically, I'm sorry. Specifically, are you aware of problems facing medicine society? Jordan touched a little bit on this. Cost, insurance, how does that work? When you're working with a population, do they have insurance? Do they not have insurance? Why? What are some of the factors that determine that? And that's where you can look to the right. You can see the sort of defined areas of what we think about when we think of social determinants of health. But we're really, all of this is to be said. And then, you know, sort of the disparity issues, access and maldistribution issues, and specifically structural racism and how that has impacted, you know, populations and communities. And all this is to say that the other important thing that our committee is often looking for is, do you have an understanding of the patient perspective? And again, that can be a lived experience. It can be an experience where you worked with a population or a community, but you're not just observing the sort of pathophysiology of disease, but you're really looking at it from a bigger picture of perhaps why this population experiences a particular burden of disease differently than another population. And that's where this sort of comes into play. And can you speak to that with some depth and some knowledge? So this is one of those areas that's of relative importance to the School of Medicine, because once you get into medical school, this is a very common thread that we want people to recognize how, not just how disease happens from a, like I said, the pathophysiology sort of aspect, but how disease happens perhaps differently for communities and why that is. So it's important for you to be able to speak to this as well.
So another thing, you know, and I touched on this earlier, and of course, if you've interacted with any of our other resources, you've heard our emphasis on reflection before. So just to recap what we mean by reflection, the reflection is the nuance, it's the depth, right? So it's not just the description, as Ravel was talking about earlier, it's the what you learned, it's what it meant to you. And so this is going to be the why, the so what. Now, I don't know if any of you had a professor, as I did, who would write that on your English papers, right? It would say, I would write what I thought was a great, you know, conclusion or thesis statement, and they would write in the margin, tell me more. So what, why, these kinds of questions. These are the questions we want you to ask yourself when you're pushing yourself to reflect on your experiences. And one way that you can get that practice is through journaling. So I like to recommend that applicants keep a journal when they are experiencing their journey in medicine. So like this can be a journal entry about a specific clinical experience that you had, where you come home and say, okay, it was just a little quick note at the top, 4 hours, here's where I was. And that can be helpful, right? When you later do your AMCAS application, you have to say how long you did something. But then your notes on it are, you know, maybe a brief description of what happened, but then you want to dig into what it meant to you. How did you feel when these things were happening? How did the patient feel? How did the physician feel? Why? How? So what? Right? Dig a little deeper. So you might have a surface level kind of reflection, like, this experience was important to me because I was really able to connect with patients and see how valuable it was for them. I thought I was going to be into the pathophysiology, but then I really was captured by the patients and their experiences, and that really meant something to me. Right now, people write that or say that, and that's a good surface level reflection. We want you to dig deeper, right? Why what was it that the patient's experience that drew your interest? How did the how would a physician then, how would you as a physician handle the situation differently, right? These are the kinds of things we want you to be reflecting on. And if you do a lot of this practice work before your interview, it's going to be a lot more natural when they ask you a question that you maybe haven't considered before to be able to do it, right? Because you've put in the work and you've practiced your sort of reflection muscle, because it doesn't come naturally. You do have to practice it. So we do recommend that you do that. And that can be, you know, not only clinical experiences that you physically go out and do or virtually do, but these can also be those consumables that Jordan was talking about, right? So if you're listening to a podcast, reflecting during and after can be really helpful too. So one of the things that is tied into this is this idea of intentionality. So when you are, once you've sort of thought about your reflecting, you're going to be more intentional when you experience these experiences. These sort of questions are going to come up for you as you go, and you'll find that it helps you then be more intentional about future experiences that you seek out, but also how you interact with the experience as it's occurring. So this is not the thing where one day it's just going to be, yes, I can do it. This is an ongoing, lifelong learner kind of thing. And it's important that physicians are lifelong learners, not only because medicine changes, but also because we have to be, we should all be evaluating ourselves and thinking about how we're interacting in the world and with patients and with our colleagues. So if you aren't already, I recommend you start journaling and start maybe even having conversations about these kinds of things and reflecting on not only your past experiences, but any upcoming ones you have.
And then we really want to talk about communication skills, because a lot of these things won't come through if you aren't able to communicate them during the interview. So I cannot emphasize enough having good communication skills. That includes both verbal and nonverbal. We want to make sure that you're listening actively. You're listening to the entire question, you know what's being asked of you. You're also making yourself understood. That's a really important skill. A lot of times something can make sense in your head, but when it's coming out, it's maybe not coming out the exact right way. We want you to be clear and not ramble, and also be able to put yourself in somebody else's shoes. This is really important because when you're a practicing physician, you will be dealing with people from lots of different backgrounds. This also goes in with just being able to understand your patients, understand where they're coming from. And that goes with putting yourself in their shoes so that you're able to communicate better. Respecting other people's opinions, allowing for different values, and not judging. Another thing I want to touch on is all of these things, since we're moving so rapidly into telemedicine, it's so important that you're able to, excuse me, communicate these through a webinar like we are right now. So much gets lost when you're not in person. And so it's really important that you are able to communicate through those changes in medicine and still maintain that great patient-physician relationship.
Thanks, Ravel. I'm going to try to get through this slide, and I may have Jordan rescue me if it feels like I can't get through. But I do want to talk about preparedness. We touched on this, I think, a little bit in the opening remarks, but when we were sharing pitfalls, and again, we're trying to come up with where are the places that people struggle a little bit, and what are the comments that our committee members make when we review applications of those who have not been successful after the interview. And one of the things that comes across are these sort of descriptors of how somebody interacted and came across in the interview. So it really does sort of have somewhat to do with communication skills and then the approach. So there's always the possibility of just not preparing enough. And so obviously that's one place where we would like you to maybe reflect on your answers to the questions, if you remember what they were from your interview experience, look at your application all the way, review, and based on the information we've shared with you thus far, were you prepared to sit in the interview situation? Remember, our interview is a 3-person panel interview. So, and we will continue for the upcoming cycle for the entering class of 22, we will continue to do virtual interviews. So it'll be in this format. So are you prepared in that way to be able to communicate like we are on this webinar, appropriately, articulately? Do you feel engaged? Have you figured out strategies to be able to do that? Because those are the things that often we'll hear back from the committee, that they just didn't get it. They couldn't connect with the person, couldn't feel their empathy. They couldn't quite, sort of figure out where they were coming from. So preparedness is important, and recognizing that perhaps last year, none of us were very prepared to be able to do interviewing and just interact in a virtual format. But now, a year or longer into it, hopefully you've had more experience with, sort of being in a virtual setting and being able to convey your story really in a way that's meaningful and that people can connect with, despite not being face to face or in the same space. So being prepared means knowing your story. If you've followed any of the advice sessions or feedback information kind of things we've provided in the past, I think this is a very common theme for us. And many medical schools feel the same way. It's really about, do you know your story and your journey into medicine? And can you articulate that and share that with committee members in a way that's meaningful, impactful, so that they understand who you are and how you fit into our medical school community? So if you haven't spent time sort of thinking about your story, now is the time to do that, to really be able to say, I'm so-and-so, this is my passion, this is where I see myself in medicine, and this is why, sort of having some sort of not overly polished, but sort of understanding the concept of who you are and what is your journey into medicine. That should come fairly easily to you. Also, being prepared is knowing what's going on in the world, right? Know what's happening in the world of medicine and in the world. We have experienced some unremarkable, some remarkable and we hear this word all the time, unprecedented sort of happenings in our world over the past year. So really, you hopefully have used those skills that Sarah was talking about previously to sort of reflect on, what does that mean? What does that mean to me? What did that mean to my family, my community, our country, the state that you live in? How does it impact the healthcare and healthcare access? All of the things. Like, spend some time reflecting on that, spend some time in having some depth of knowledge, because you'll be asked about medicine, about the healthcare system. Perhaps you'll be asked about, sort of what's happening on a social justice sort of in that arena, about and how does that affect health and health outcomes. So spend some time, but don't offer it up if you're not asked. That's the other sort of thing about if you learn something and we don't get around to asking you it may be that we learned enough about that sort of area from your application that we don't need to dig any deeper. So make sure that you're not like offering up information that's not solicited, and make sure you're understanding these concepts in health, in medicine, and in the world because you care, not just so that you can show off that the latest story that's trending on Twitter at the moment, because that really doesn't tell us much about you. And again, having some sort of parting thoughts. So what do you want the community to be sure to know about you before you leave the room? And oftentimes we'll ask that very question at the end of the interview. So did we forget to ask you anything, or what do you want us to know? That's the time to be prepared, not overly polished, but you can even, practice, like, here are the things I want you to know about me and why medicine is right for me, or why UW is right for me, sorts of things. So have some, put some time into thinking about that. On the flip side, we want to make sure that you don't come across as overly prepared, or, sort of polished or rigid, or just reciting things because you rehearsed them, and you want to make sure that you share with us all the things that you rehearsed, or the answers that you have prepped. So make sure that you're, as Rabail said, make sure you're listening actively so that you're understanding what the conversation, what your committee is asking you in terms of where they're taking the conversation. Make sure you're answering that question as opposed to just reciting your polished answer on a specific topic. So if you hear, oh, this is they're asking me now the question about, healthcare systems. I have rehearsed my, sort of ideas about how to reform healthcare, and I'm just going to spit it out. That might not actually be what the question is. So make sure that you hear the question and that you answer the question that's being asked. We prefer that you avoid sort of buzzwords or talking in sound bites. It's certainly appropriate. I just talked to you about the social determinants of health. That's not so much a buzzword as it is a concept, and it's understood within medicine sort of where that comes from. But if there's a lot of media attention or things related to other topics, it's better if you're speaking really your own language and your own truth in terms of how you understand that and how that affects you and the community you live in or the people you serve, as opposed to just what's popular in sort of the media or whatever. And sound bites are sort of the same thing. There is the notion, and for many applicants, especially if this is a little bit outside of your comfort zone, to be in a place where you're having to talk about yourself. Many of us come from backgrounds where that's not what we do in our culture, or perhaps we've not been on this sort of platform before. So you're encouraged to be confident, but there is a fine line between confidence and arrogance. If you're coming across too overly confident, or sometimes the word is cocky, or flip, or there are ways to approach problems, and there are ways to ensure. Again, I think if you've baked yourself in experiences that are genuine and that are intentional, as Sarah said earlier, then your confidence will show through without the arrogance. Sometimes arrogance comes from the air of arrogance can come from insecurity and lack of confidence. So just sort of be mindful and practice. So when you have the opportunity to come to an interview, perhaps it's worth putting your panel of friends together and having them ask you questions, or practicing listening and watching yourself in on a recording or in the mirror. So but now you have your iPhone or your phone, and you can just put it up. You can record yourself answering a question. What did you look like? How did you come across? What was the tone of voice? Did you use a condescending tone, or what are the things that you can observe about yourself? So doing some practice in order to find the balance of being over or under prepared. I think with that, I think at the end of all of this, what we were hoping that you would be able to do is like I said, we kind of pulled from reviewing lots and lots of applications for folks in the past, and even in the past year, looking at those who were unsuccessful and saying, what are some of the common themes that came through? So we shared those with you today. Shoot, my questions away. We shared those with you today in the hopes that you could then reflect on your own experience, think about your own interview experience, perhaps even in the application, where some of these common mistakes and common pitfalls might apply to you, so that you can do a self-reflection, and then sort of utilize some of the information that we shared in terms of strategies of how to improve and apply it to your own situation. Team, do you have any final thoughts that you would like to share as well?
Yeah, did we want to try to cover some of the questions that came through?
Yep. Yeah, that's where we want to transition to. If you want to, that'd be great.
Yeah, one of the questions that came up that I wanted to address is that is of particular, for reapplicants, they want to know how much should I like repeat, right, the second time around, like especially like in the interview. What do I, do I repeat something? Is it weird to repeat something from my application? And the answer, of course, is it depends, right? So the interviewees or the interviewers will have read your application. So in our process, the way it works is your executive committee member, so one person on your panel, will have seen everything in your application, including your metrics. But the other two do not see metrics, but they see everything else. So they've seen all the reflection, they've seen your personal statement, they've seen the letters. So they've seen your experiences. So if they ask you a question, for example, about a patient encounter that was meaningful to you, and you repeat something from your application, you're not really serving yourself. You're not, because you're not giving them more information to round out their holistic review, right? This interview is going to add to all the information they already have to create an even fuller picture of who you are and what you bring to our school. So you want to give them as much evidence as you can that you're going to be a great asset to the school and to medicine. So it's in your best interest to reflect on other experiences that you can add. Certainly, if you've reflected on an experience and you have more to say about an experience than you were able to in your application, it's not, it would be appropriate to do that. And again, it's more about adding to what you've already provided to us. So it can be really helpful. Just some basic advice. Part of that preparedness that was just talked about is look at your application that you submitted to us. Review your AMCAS application, review your secondary, see what they see, right? Obviously you don't have access to your letters, but you can see all the pieces that you submitted. And so it helps you sort of think about how you want to complement what you've already provided in rounding out who you are and explaining your journey. So, so while it's not necessarily a red flag to repeat something from your application, it's not necessarily going to serve you in giving you giving the committee more evidence about your preparedness and readiness for medicine.
And I think bouncing off of Sarah's brings up a really good point of, this is also another question that we received that's also very common is, okay, so I got an interview, like, do I need to update my application? Obviously, it was good enough to get an interview. And the answer is yes, you do need to update your application, even if you got an interview the prior time, because just because you got an interview before does not necessarily guarantee that you will get one the next time you apply. So that is not guaranteed because what we're looking for, right, not only in the application and interview is growth through that time. And whether you are applying the cycle after, or if you've taken time off in between a year or more, we're looking for that growth. And so not only, as Sarah was saying, do you want to, not necessarily repeat exactly unless you have more to give in the interview from your application, know that also we're looking for growth from the last time you applied in both of those settings as well. So even if you gain an interview, you do need to relook at that application. You need to relook at your personal statement, those experiences, how you write about them, bring the new nuances that you've learned and grown with over this time. And if you find that you don't have a lot more to give, or that you're kind of in the same place, maybe that means you need more time potentially to do a little more exploration and growth, because it's not an issue for people to take a little extra time after applying to reapply. We're not looking for you to necessarily reapply immediately the next cycle. It's not an issue if you take a little time, and often people perform better if they give themselves a little bit more room prior to reapplication. But that's when I think Sarah just kind of touched in perfectly to, it's about really growing and giving those nuances and giving something new for the new evidentiary support, because your committee members will, at least the executive committee member, will be able to see the prior application. And so it's all about that kind of building on top of. So, just as we wouldn't want to see the exact same personal statement necessarily, because we would expect you to kind of relook at it, reflect and grow, that, like Sarah was saying, you need to kind of bring that to the interview as well, of kind of where you've come from, where you've come and how you've kind of grown through that.
Another question that we got was if passing on a question is seen as a red flag in the interviews. Generally, if you are being asked a question about a particular experience that you've talked about in your application that you maybe don't want to elaborate on, I think that would be fine if you pass on that. But if you do have it in your application, you will be asked about that during the interview. So that's just something to think about when thinking about passing on a particular question. Our purpose is not to make people uncomfortable with their questions. People are not trying to probe you and understand. They're just trying to understand how you've grown from your experiences and how you can reflect from them. So certainly not seen as a red flag, but just something to think about. If you've talked about it in your application, it may be brought up during the interview.
And then, of course, if there's something that's brought up that you feel is inappropriate or incredibly sensitive or is not in your application and is maybe very deeply personal, it is okay to kind of contextually say, like, you know, I may not be comfortable in answering that. If you're doing that consistently through the whole interview, that might be something, you know, that you need to reflect on. But also you can contact our office at any point if something like that happens. But yeah, to Rebecca's point, it's you know, okay to skip it if there's something that either feels incredibly uncomfortable or a little too personal. But that, yeah, if it's in your application and you've shared, you know, it's kind of open for, you know, a little bit more questioning, and that generally isn't around personal information. It's usually around, yeah, that needing to just garner more depth or nuance about something you might have mentioned previously.
Another question that we had was just about somebody's competitiveness from one application cycle to the next. So couldn't they expect, if they got an interview in one application cycle, will they likely or automatically be invited to interview in the next? And I would say no, that we do a specific review of applications every year comparing the cohort at hand. So it's not based on what you've done previously or how you performed previously. That information is available, but we certainly look at the application as it is. And again, we can't emphasize probably enough what Jordan and Sarah have already said about, you know, so we're looking for what is different about you this time that's making you more of a compelling candidate. What have you done, or how have you changed your perspective or your reflection, your understanding? Did you get different experience? Did you do something different? What makes you a competitive candidate in this pool? So there isn't an expectation that if you make it to a certain point in the process one year that you'll automatically or have a higher likelihood of getting to the same or further in the next application cycle. So it is imperative that you are doing this self-evaluation and ensuring that you're making notable improvements in both your application and then your preparedness and your ability to speak to it. I don't know if the team has other ideas about that particular concept.
Well, I had something slightly different. Jordan, did you have something to add to
Nope,
her?
you're good, go for it.
I wanted to touch on this. I wanted to emphasize that if you are a reapplicant, I want you to think about how that is an asset, right? So rather than, I know that it can be disappointing not to be successful when you apply to medical school, but I like to always try to find a silver lining or look at the positive. And one of the assets that you will bring as a reapplicant is you'll be able to demonstrate growth to the committee. As I said, we want people who are reflective and who are lifelong learners, and you have an opportunity to give evidence to that, to the committee, that someone who's a first-time applicant, it's going to be harder for them to demonstrate that, but they will have solid evidence from your first application or your previous application to your subsequent application that you have that capacity for growth and self-reflection and change and development. So I want you to think about it from that perspective and think about how you can prove that to the committee. There is a question on the secondary about what's changed since you applied previously as a reapplicant, but really this can be infused throughout your entire application and interview, thinking sort of like how you have grown. And this should be something you'll be thinking about as you reapply, is how have I grown and changed over the course of time since I previously applied, not only because of the disappointment itself, but because of all the other experiences that I've had since that time. So, so as you reflect moving forward on your journey, do keep that in mind, that your reapplication actually can be an asset to you as an applicant.
And I would say specifically, if you've taken the time to reflect on perhaps anything that we've shared with you today, some of the more compelling interviews that I've sat in on are with reapplicants who share their journey within their story, that along their journey, that actually not getting into medical school was probably one of the better things that happened to them, because now, you know, understanding what the expectations are and what they're getting themselves into, they were able to do that growth and personal development over that time, so that they're much better prepared to be a good medical student and be a good physician in the future. And so I've seen that happen, and I've interviewed folks who, you know, can genuinely, you know, sort of share that part of their journey with us in a way, like Sarah said, for it to actually be an asset in terms of being a reapplicant, as opposed to, you know, sort of having been crushed and you know, sort of upset with the system as if, you know, there was something wrong with it. So it is about, to some degree, about your approach as well.
I think that lends itself to a question we often get as we're talking about that kind of, right, the growth, the kind of re-reflection, kind of the reorienting of your mindset. Is we get asked a lot of, you know, if I was a reapplicant, or if I didn't get in, or even if people are taking a little break in between, what do you do during that time, right, to kind of facilitate, you know, what does the committee want to see, or what do we want to see in the application for those who are reapplying? And I think it's a little nebulous, right, in that there's no perfect answer, but just to kind of touch on that question we often get is, you need to continue to explore, right? It's a lot about that sexual reflection. That's what these two kind of sessions we've done really hinge on, is your ability to kind of sit back and maturely say, okay, what can I do to self-assess what I've brought here? What can I see that I can improve? And how do I go about improving that if I find that there's holes that I notice or things that I want to work on and grow? And some of the things we've touched on, right, are those kind of big pieces, right? Maybe it's, you know, needing more understanding of healthcare systems. Maybe that's what you're doing during that time. Maybe it's, you know, finding that you need to maybe explore a little more of other healthcare professions, or just other professions. If you're saying, maybe, okay, maybe when I'm reading this, I sound like I want to be a dentist. And you're like, oh, maybe I need to really sit back and rethink about that. Usually it's not dental, usually it's someone who's maybe better in social work or public health, and maybe discovering a little bit more about that and seeing if that actually piques your interest more, or if it reaffirms that you want to be a physician, right? So when you're taking that time, while you're doing that reflection, while you're, you know, kind of doing that kind of self, you know, inner look, also taking that time while you take a break, or as you get ready to reapply, to make sure that you're not just kind of pouting, you know, during that year off, or during the couple months as you try and reapply. You know, have your time to, you know, grieve, definitely, but also what can you be doing in the meantime to help you continue to grow back into where you want to be? And as you're identifying key points in your application or interview that you know you want to work on, how do you find those? How do you, you know, build yourself to be the potential medical student and physician that you want to be? And what are the pieces that you need to do that? We can't tell you exactly what that looks like. It's going to be something that you have to find to some extent. And so it might be trying a variety of things. We know access to certain experiences are harder now because of the pandemic, but are there other ways to garner it, right? As we talked about podcasts, or in connecting with friends or family to have discussions around, you know, how, you know, health or where they live or economics impact their health and well-being. Is there ways you can start learning about these in a way that's, you know, safe to do so at these times, but that can really help you grow and understand during those times? So that's just one that we often get that is hard to answer, because there's kind of, we can't tell you kind of the pieces to do. It's really finding where you find you need to grow and to become the person you're hoping to bring to the table when you're applying to medical school.
Perfect ending note to end on today. I think we've come to pretty close to time, and we'd like to honor that for you. But I would just like to say to all of you who've taken the time to either join us live today or who'll be watching this at some point in the future, that we really do appreciate your willingness to learn more about how to improve your application, we do have resources on our website that we've got posted here for you. You can send questions to us via email, reach out to try to answer any more specific questions. But really, I think our main message is always just about know your story, be able to share sort of your medical journey with whomever you come in contact with, that whether that's through the written application or in the interview. But really, it will serve you well to kind of know who you are and why this embarking on this very daunting task of getting into medical school and becoming a physician makes sense to you. And I'm sure that it does. You just have to figure out how to share that with others and ensure that you're the right fit for us and we're the right fit for you. So thanks for joining us today. Again, reach out if you need to. Take care of yourselves, be safe and be healthy.